This is the management of genital herpes in parturients. This is moms who are laboring who have genital herpes. Genital herpes is a locally recurring disease. It's also called HSV2. The primary infection is what you get first. It's a viremia. You might have fever, chills, systemic symptoms, and then you have recurrent episodes with less severe symptoms. You usually do not have a viremia with the recurrent episodes, and the mom usually has antibody protection at this point. There are some risk factors for spreading herpes to the baby. You have higher risk with primary infection, of course, with the systemic fever, chills, viremia. You're going to be at higher risk of spreading that to the baby. You also have increased transmission risk if the mom has active disease during the labor. So if she has a recurrent episode with actual active disease and lesions in the genital area, that'll be at risk for spreading it to the baby. You want to avoid vaginal delivery in this case. There's also been shown to spread genital herpes to the baby through invasive fetal monitoring. So you want to avoid that if the mom has active disease. Some recommendations for delivery. C-section is recommended if the mom has active genital lesions with prodromal symptoms. You don't need to do a C-section if the mom has a history of genital herpes without active disease. Primary versus recurrent infections have different transmission risks, and you want to specifically monitor for active lesions during delivery. There are some retrospective studies that show no serious neurological complications from neuraxial anesthesia in recurrent HSV2. So if the mom is having a recurrent episode with genital herpes and active lesions down there, you can still do a spinal or an epidural anesthesia. The safety is uncertain for primary HSV infections. So if, again, going back to these systemic symptoms during the primary infection with the possible viremia and the fever and chills, there's a theoretical risk of spreading the virus to the spinal cord by doing a spinal anesthesia. So the safety there is uncertain and it's usually avoided. This is, of course, an individualized decision, and you want to discuss the risks and benefits of neuraxial anesthesia with your individual patient.